Mendoza and Hernandez. Unless I'm
I'm just in the waiting room. Yeah, they're both in the waiting room.
They're just joining right now.
I'll just wait for you, Daisy, to let me know when we're ready.
Okay, Mayor, looks like we are ready.
Great. Why don't we go ahead and get started? Good afternoon, everybody. First of all, Happy New Year to everyone. Hopefully you guys had some time to rest during the holiday break. I do want to call this special meeting to order and thank you all for joining. I'll go ahead and have the city clerk call roll, please.
Councilmember Becerra.
Here.
Councilmember Hernandez.
Here.
Councilmember Lopez. Councilmember Lopez.
Sorry, I was unable to mute myself. I'm present.
Thank you. Councilmember Mendoza. I see Councilmember is on. I'm just asking her to unmute her line. Councilmember Mendoza. Councilmember Fan.
Here.
Mayor Pro Tem Peñalosa.
Present.
Mayor Sarmiento.
Here. Great. Thank you, everybody. And I should mention that we are transitioning to a new application. So for the public and for colleagues and staff on, we're obviously, we may have a few bumps, but we didn't expect to have the special meeting. So please bear with us and bear with the clerk as she and her staff navigate this new system. But I like seeing everybody, so it's nice to not see a still photo. And we were able to at least, see each other's faces. So thank you, staff, for doing that. And I believe we only have one item that's before us on this special meeting. So what I wanted to do, Madam Clerk, is if you have any members of the public that would wish to address the council, maybe now is a better time to have them address us.
Yes, I do. I have currently 5 individuals, and I will go ahead and unmute them one at a time.
And if I could maybe just remind everybody who's on, I'm going to go ahead and mute myself, as we all should when we're not speaking. That way we don't have any background noise while we're on. So just a reminder.
Thank you. Caller with the last 3 numbers, 010, if you would please go ahead and unmute your device. If you called in, you can dial *6, or you can select the unmute feature on your device, your microphone.
Hello, can you hear me?
Yes,
Hello?
we could hear you. Yes, we could hear you. You may proceed. Thank you. You have 3 minutes.
Yeah, give me a second here. I didn't expect to be called on so quickly, ma'am. Hold on.
Okay.
Very good. Thank you. Okay. So I'm calling in support of the action today. I think it's an outstanding action, and I applaud the leadership of the entire council in trying to help mitigate the virus that is affecting our community, our state, and our nation. It's just not for the physical health. I think you should do this, but also for the mental well-being of our community, and as well as the financial and economic recovery of both the city and our residents. I'm especially concerned at this time about the effect of our younger children, the ages 3 to 4, who are lacking socialization and needed learning environments at this time. I'm deeply concerned the long-term effect this might have. And I'm simply encourage the city, our leadership, to seek out solutions to this. Is there a solution? Can we do something? We should not let the thing go unrecognized because the consequences can be quite significant. So please put that on your agenda, on your radar. I just want to speak very briefly about the mental health aspect of this. For the third time since I moved to Santa Ana, my life has been threatened. I was held at knife point a few weeks ago by an individual who wanted my money. He obviously seemed to be rather disturbed, and I was able to negotiate with him and get him to put his knife down and walk away, and I gave him a few dollars. But again, I think COVID in itself has led to a lot of mental health issues. My situation was rather severe, so please, the issue of COVID goes beyond our physical health. It goes into our mental well-being and the mental well-being of people who are suffering. We don't want to see these situations come up again. And this gentleman who held me at knife point, certainly needs help. I'd much rather have a police officer than a mental health worker, but people like this do need our help. And while the virus vaccinations and testing is great, we need to take a deeper dive into the mental health of our community. And with this $800,000 we're spending on this lawsuit, I hope we can find a way to achieve this sooner rather than later. Lastly, we also have to be cognizant of how we distance ourselves from our community. I think this new technology is a great idea, but it shouldn't come at the expense of distancing ourselves from our leaders, our city hall. Even in my own experience in trying to work with this new technology, the Prime Gov, I experienced some difficulties. I found the instructions also to be a little bit lacking. I felt also the city clerk's office was very responsive, but these are the types of things we should watch for. And if anything, we're going to be rolling out technology to the end user, i.e. the citizens, and we certainly need to test it with the citizens before we roll it out and to work out any bugs or technical difficulties. Having done a lot of technology in my past, despite my advanced age of 62, things need to be done correctly. We need acceptance testing. We need end user testing. We need good standards. So please keep this in mind as you look to digitalize our government, but also don't use it as a way to divide and further separate us.
Victor, thank you so much for your comment.
Excuse me?
Your time is up.
Hello?
Your time is up. Thank you for your comment.
Hello?
Hi, thank you for your comment. Your time is up.
Thank you. Thank you.
Thank you.
Mm-hmm.
Madam Clerk, are there any more members of the public that want to address it?
And yes, and I'm waiting to see if whether or not, okay, I'm admitting them and I'm looking to see if they are able to unmute themselves. One's just a video. Okay, Mayor, it looks like that's all the callers we have, all the participants. Everyone else is staff.
Great. Thank you for that. So the only item before us is the consideration of authorizing the city manager to negotiate with vendors to provide additional COVID testing and/or vaccination testing upon arrival of those units. So I'm going to go ahead and turn it over to the city manager and staff to go ahead and give an oral presentation. I know we did this on very short notice, so we weren't able to provide anything in writing, but to the extent that the city manager can go ahead and give us some sort of verbal presentation, I'm sure that will suffice.
Right, thank you. Honorable Mayor, Mayor Pro Tem, and council members, the item before you is based on a request to provide services to our residents. It's really two items. It's to authorize an appropriation adjustment that would allocate dollars from our general fund reserve and provide me an amount not to exceed of $750,000. $500,000 will be coming from CDBG, with $250,000 coming from the general fund. With those dollars, should you decide to, I'm seeking authorization for myself, working with the city attorney, to execute any necessary agreements with contractors, subrecipients, service providers, in order to provide both testing and vaccinations. You all know our city has been hit extremely hard. I know you know the numbers of the cases and the numbers of deaths in our community. And we were very fortunate when we had available CARES dollars to roll out many programs, but with those funding, with that funding being exhausted, we did have to pause many of those programs. So to restart testing with the allocation of a not to exceed of $750,000, I am trustful that we could get something up and running pretty quickly. I have already been in conversations with a couple of different vendors that do that type of work. Also been in conversations with Santa Ana College, and who are more than willing to allow us to use their site. And on the vaccination side, as the distributions of vaccinations start to happen, and the state of California did receive vaccinations starting back on December 16th, there are not substantial quantities that are currently being received, but in the future, I'm hoping those quantities will increase. Right now, since we are under the umbrella of the County of Orange Healthcare Agency, we look to them for the distribution of those vaccinations. They have indicated that they would like cities' assistance and collaboration. So I do believe that in the future, there's an opportunity for the city to help host a site within our city for our residents that would make it a lot easier for them to get those vaccinations. But as you can imagine, it's an extremely complex and challenging process. Not only are the vaccinations limited right now to a pretty small population, the state has put the priority into different tiers and phases. And currently we are only at phase 1A, which is about 3 million individuals across the state and its healthcare workers, and then those that reside in senior living centers. But as the tiers move through and greater populations are able to get those, I think that we have an opportunity to assist with the vaccinations. Right now, as of this morning, the county did relay to city managers of the county that their priorities and focus are going to be at establishing up to 5 super sites where they will begin the vaccinations. But to put the scale in perspective, right now the County of Orange only has 19,000 vaccinations. So what I am asking for with this staff report is authorization of the not to exceed 750,000, and then the authority to initially start with the testing aspect, and as the opportunity arises, to get a jump start on potential vaccinations for our residents. And if I'm happy to answer any questions, and if I didn't cover anything, I'd be more than happy to go into more detail.
Great, thank you for that, Madam City Manager. Let me go ahead and do this since since we're still figuring out this new app. Why don't I just go one by one for all the council members to go ahead and ask questions, make some comments, but that way we can all have an opportunity to kind of share our thoughts with you and maybe ask a little bit more. So let me go ahead and start with Councilmember Becerra.
Thank you, Mr. Mayor. Well, first of all, I want to begin by saying that I am proud that I serve on a body where all of us have got together on such short notice outside of our normal meeting times to try to address a very important issue. And I know that after our CARES Act money ran out in 2020, we all shared concerns about what we could do to continue to help our community, because as we know, we are so impacted, more so than any other city here in Orange County. With that being said, I wanted to ask a couple of questions. So first I wanted to say, so our CARES Act activities that our city staff, by the way, carried out exceptionally throughout 2020 were funded by federal and state money. So there was no local money involved in that. Is that correct?
Correct, sir.
Okay. And we also, as far as right now, the fact that we don't have any more CARES Act funding, that's because we were instructed to spend it. It's not like we plan to do things going into 2021 and then we just ran out of the money. I would say our staff, I want to give credit where credit's due. Our staff laid out a plan that showed how we could spend that money effectively to get these services out to our community, but recognizing that we had an expiration date of these funds at the end of the calendar year 2020. Is that correct?
Yes, it is. And if I can add a little more detail, we did not receive any direct allocation of the CARES dollars from the federal government. We sought and requested it from the county and the state, and it was the state of California that gave us the bulk of those dollars. And it had the restrictions that they must be expended by December 31st. We then had to back up and stop expending a little bit prior to that, just so we could do the accounting processing over the holidays. The bill that was just recently passed by Congress did allow for extension of spending those dollars, but we did not want to forfeit any of them. So we did all of our programs and were able to exhaust all the funds by the original expiration date.
Thank you for that. So what's wonderful, I think, with these, with what the city has done, with our staff has done with this CARES Act funding, is that we rolled it out as we were supposed to. And this was money that wasn't commingled with general fund money. This is money that came from federal and state sources and that we rolled out to these activities that we were able to commence with in 2020, correct?
Yes.
Okay. And another question I have for staff is, I know as part of the CARES Act, one of the items that we offered our residents was for those who ended up testing positive, we offered them a place to isolate, such as a hotel room. Has that program expired as well at the end of calendar year 2020?
To the extent that it was funded by those CARE dollars, yes.
So right now, if one of our residents tests positive for COVID, we as a city do not have any resources to be able to provide that person a room to isolate in 2021.
Not from CARE dollars.
Okay. I would just, to my colleagues, I really, again, I want to echo how much I appreciate what we're doing here and the sentiment that I think is driving this, that we really don't want to sit by with idle hands, and we want to make sure that we're doing everything that we possibly can to help our community and our residents. Well, one thing I do want to point out is that while we, the city, are not offering tests at this moment, we do have many testing options available to our residents, whether it's at-home testing from the county, where just this afternoon I double checked on their website to see what they were offering, and they're still offering home delivery to folks to have these tests, and they're looking at a turnaround of anywhere between 1 and 2 days. And also too, on the same county site, they're showing 6 testing locations here in the city. And then on top of that, of course, the 2 super sites that are immediately adjacent to our city, which is the Anaheim Convention Center, and then of course in Costa Mesa, the OC Fairgrounds. So I guess what I would implore my colleagues to consider is that I think testing is important, but what we have to realize right now is that we are blessed to have the vaccine on the horizon. And when I look at the news and I see that California has only gotten out 35% of the vaccinations that they have on hand, that scares me, because it makes me realize that the state is not equipped to deal with this. And I think for us to ignore the lessons, or at least ignore what's happening at the state and possibly the county level, I think what I would ask my colleagues to do is to focus more on making sure that we are able to roll out the vaccinations, because as we all know, we have a unique population compared to our neighbors in the county, and we want to make sure that we adequately, if not effectively, get the vaccine out to everybody. And you know, whether we use Santa Ana College or another site, I would want to make sure that our site is the gold standard, is the example for what others would look to. And I think if we wait for the county to do it and we don't invest in that effort, I think we're going to be far behind. And right now with testing, if somebody is tested positive and they're not able to isolate, I think all we're doing is scaring the heck out of people. I think what we really want to look at more, in my humble opinion, would be vaccination. So I would ask us at this point to start looking at any sort of allocations from our general fund.
I think Councilmember Becerra maybe.
Which did I
you
cut
did
out?
For a few minutes, or for a few seconds, actually.
Sorry about that. Well, I just wanted to say is that, I think while we do have some additional funding on hand at the moment, I think that our staff is probably more equipped to speak to this, but they deserve the credit for providing us a balanced budget in this current fiscal year. But I think every penny is going to matter as we go into our next fiscal year. So rather than commit general fund dollars to testing when we have testing options all around us and in Santa Ana, my ask of my colleagues would be for us to focus, as many other jurisdictions are, and pivot towards the focus of vaccinations and making sure that our site is able to deliver to our residents as effectively as possible. Thank you, Mr. Mayor.
Great. Thank you for those comments. Councilmember Hernandez.
Thank you, Mayor Sarmiento. For me, I think this is a step in the right direction. I think that this is exactly what we need to do. I'm happy that we were able to get together on such short notice, as Councilmember Becerra echoed. For me at this moment, I would just want to know about the services. Would we continue to operate within the same scope of the CARE program, where we would provide testing sites at parks and different locations like that?
Thank you, Councilmember, for the question. So we could model it however we'd like to and negotiate with the vendor. One of the efforts that I've been trying to do is, because we do have limited resources and we're using CDBG money, which is restricted to income eligible recipients only. So we have that factor going into it. That's one of the reasons why the coupling of the general fund dollars will give us a flexibility to cover those who are eligible and not eligible. It could be a fixed site, similar to how it was operated when we had the CARES dollars. We might even find it beneficial to try to activate, once again, a mobile unit that could go out into the neighborhoods. That was very well received and greatly appreciated by our community. So I look to you for your suggestions and what your preferences would be. And then I would do my best to negotiate the means to get it done.
Thank you.
Great. Thanks for those comments, Councilmember. Councilmember Lopez.
Hi, thank you, Mayor Sarmiento. City Manager, I have a question for you. I know we just talked about modeling, but is the plan to use the same vendor we were using in 2020?
We have not entered in any contract, and our contract with the vendor that we did use before has expired. So the two vendors that I am talking to is the one that we have used in the past, and then a new one. And I'm trying to get the best cost for us and in the best manner. So no decisions have been made, but the vendor that provided it before has submitted a proposal.
Okay, thank you. And are we also, when speaking with vendors, asking them how many more folks they can provide on sites for testing? Because one of the observations I made in the past was that there was really long lines of people trying to get tested. And so if it's possible at all, moving forward with the testing, that we can have more people on site.
Absolutely, and thank you. We did have some hiccups on the amount of volume and the timing. So we've learned we've streamlined a little bit up through December, and we did get to fix a lot of those glitches. So we will certainly take that knowledge base and apply it in any future testing that we were able to do.
Thank you. And another comment, I'm very happy that we're going to be offering, the city is going to be offering testing. I know that there's testing available through other organizations and through the county and in other cities. But I do want to echo the sentiments of Councilmember Becerra, the concern of having a focus on vaccination. My understanding is that the general population will begin to receive that within 3 to 4 months. And I know, I read in the staff report that we will be having a presentation within the next 2 weeks regarding the county's plan. And so just keeping that in mind that, I am supportive of providing testing, but we should start to move the focus on vaccinations and the rollout of that. Thank you. That's all for me.
With the vaccinations, if I may, one of the challenges that we have is we are under the umbrella of the healthcare agency at the county. So currently, as all of the distribution plans stand, we would not be a direct recipient of vaccinations from the state. Our distribution would be through the county. So I know we're anxious to assist our residents in that process, but a lot of it is not completely within our control. The county has indicated that, down the road, they would be favorable should we staff our own site to do those vaccinations. So there are a lot of hurdles on working this out right now. I know that the county has established a task force. You can search the website at the Orange County Vaccination Task Force and find out information, but a lot of moving parts. The super sites seems to be their priority at this time, but I can certainly stay involved and see how best fit we can receive vaccinations, but that is going to be one of the hurdles. Another hurdle we have is with the state's guidelines and the limited number that can receive them right now. Until that is opened up, it would be very difficult to have our own site. And then the biggest hurdle is just the numbers of the vaccinations, and getting them rolled out is going to be a challenge. But we are working with lobbyists. I know the mayor, I don't want to speak out of turn for you. He's working with the governor's office on trying to expedite all of that.
Thank you. It's really great to hear that. Thank you.
Great. Thank you, Councilmember Lopez. Councilmember Mendoza.
Thank you. I think my unmute button is working, correct? Everyone can hear me?
We can hear you.
All right. Yes, I'm pleased to see that the city of Santa Ana is offering extended services for COVID testing. And some of the questions I had have been answered as far as the provider and the vaccinations and the other services. I'd like to know, in addition, are we going to be including some of the self-test kits where the residents can obtain the results at home? Is this part of the package, part of this new package that we're proposing?
Council member, it certainly can be, as if I'm authorized to negotiate those agreements. There are 3 different types of tests out there right now. The gold standard obviously is the PCR test, which is one of the more expensive tests, but the other type is the take-home kits, and that is one that can be done at a less expensive means. And so both of the vendors that I have been talking to have access to both types of tests.
And what's going to determine which vendor do we select? Have you received proposals from both vendors? And what kind of services are they going to be offering?
So the ask was if they could staff a site within Santa Ana and provide testing to our residents with more than likely a not to exceed amounts. We did ask for them to exhaust all third-party billing options that they could to reduce the cost to the city. And we look to them to provide cost estimates on which type of test. So the 2 vendors, there's one vendor that's Clinic 360 that is in the process of providing us a term sheet. And then, as mentioned before, our vendor that we used when we had the CARES dollar, they have submitted a proposal as of last night. I think we might have, oh no, there you are. Council member, does that answer your question?
I didn't quite hear all of it, but as a further question is, we were using Medica and Latino Health Access previously, and so now you mentioned there's a third one, 360.
So we did not contract with Latino Health Access. They were under contract with the county. So the city's contract was with Medica. And then 360 is a clinic that is the provider that's currently operating the two super sites that are up at the Anaheim Convention Center and at the fairgrounds under county
Okay,
contract.
so we are considering then just 360 and Medica, not Latino Health Access?
I have not received any proposal from them. I know they are still under contract with the county and working very hard at doing the testing on behalf of the county.
Okay, so are we going to go with just one or both? What would be more beneficial for our residents?
What I would recommend is the priority to determining who to give a contract to, should you authorize me to do that. It would be basically, do they have the right type of test? Do they have the staff to be able to equip the site? And most importantly, can they bill third parties? And is the cost, I don't want to overpay for the product. So I think cost needs to be a determining factor.
All right, so I see that maybe the vendor, such as Medica and 360, they will be negotiating with their vendors, right, to see who could provide them the same services for the least amount of price. In turn, they could offer a discount to our residents. Is that right?
I'm not privy to what those two providers would need to do to procure the equipment. They would need to fulfill our contract because our contractual arrangement would be solely with them. To the extent they rely on other parties, I wouldn't have knowledge of that.
Okay. Is that coming back to us to select one of them, or is this what you are going to be getting authorization for to select either Medica or 360?
So the way that the staff report is written right now, we would be seeking authorization for me to negotiate and execute those. You certainly have the ability to change that recommendation, but as it's worded right now, it's to authorize me so that I can do those negotiations and execute an agreement.
All right, thank you, Christine.
You're welcome.
Thank you, Councilmember Mendoza. Councilmember Fan?
Thank you for answering all these questions, City Manager. I think most of my colleagues addressed a lot of them. I would like to see options for the take-home kits or the at-home kits. I stood in line, drove in line, done the take-home kit. I've done all of it. And I do have to say, standing in line is scary, because you are willingly exposing yourself to other people who are known to have been exposed to people who tested positive COVID, right? That's really the end point. And being able to do that at-home kit really gave us a lot more comfort with what would happen, especially if I have asthma, so that's scary. But if I were with someone who is elderly and immunocompromised, an at-home kit would just really give my family a lot more comfort. So I'd really like for us to see something like that. And the other thing with whoever we decide to go to, and you are the expert, you'll talk to them. It felt like a lot of it, as you said, it's going to be streamlined, but I'd like to see early check-ins, because there are a lot of cases, even when I was at one of the events, where the person gets to the front of the line after 2 hours and then finds out they're not eligible. And that's, user error in some ways too, but I think we can do a better job with whoever we get with to make sure that they communicate throughout the day with new patients or residents looking to get services. And I do echo everyone's concerns regarding the vaccines, but again, I think the testing is really the first step. And I do really like Councilmember Becerra's thoughts on options to help residents quarantine. And really, because so many, like my mom lives in a house with a lot of people, and so it's really difficult to quarantine. And so if there's some way for us to, of the funds that we're looking at, to help residents who are income qualified, but also maybe can show that they really do need support in helping to quarantine, I think that would be a good idea too.
Okay.
Yeah, that's all. I guess I didn't have any questions.
Thank you, Council Member. Mayor Pro Tem Peñalosa.
Thank you, Mr. Mayor Sarmiento. I definitely believe that we are moving in the right direction. Us as being the epicenter in Orange County, we should definitely be able to provide some kind of testing for our community. What that exactly looks like, I am not 100% sure. I'm not, at this point, I'm not too much concerned of who the contractor is, but who's going to be more cost effective to our city, and who is going to be more efficient in carrying out the testing sites, similar to what Councilwoman Pham said about those long lines. And me personally, my test was lost not once but twice over the summer, or since we started testing, by the contractor we were using. So it's who's going to really be responsible about doing these tests, and what's going to be more cost effective to us as a city. I know that I love the idea of at-home kits, whether we could even look into having these at-home kits, not necessarily or have pickup areas. Right now, I know that the county has these at-home kits that I actually just got one, have it right here. I took 2 days to arrive to my house. It's a little saliva kit, but whether, I know there's 2 types that they offer, the nasal swab, the at-home nasal swab, and the saliva kit, that if we were able to maybe look into purchasing some of those kits and having areas in our city, like little pop-up events where we provide the kits for our residents and instructions on how to do them at home, I think that would be a lot more cost effective than having an actual clinic pop-up like we've done in the past. I know there's many options available creatively that we can do. I'm fully aware that not everyone has modes of transportation in our city, and fully aware that not everybody has medical insurance. I am supportive of the idea of where we do have the option to do third-party building, we should definitely do it. I know that I spoke to the city manager previously. My health, I know, and I'm also aware that not everybody has health insurance or a social security number in our city, which those are the residents that we should definitely be able to provide a test for. But I know that my insurance company went out of their way and sent me an email and said, hey, we're willing to cover every copay at zero cost to you for any COVID testing, any COVID related treatment. So I know that these health insurance companies are also stepping up. So if there's a contractor out there, Madam City Manager, that is willing to work in doing that third party building so that it limits the cost for us, and where we are able to provide it at zero cost to the residents that truly don't have means to pay for it or health insurance, that would be beneficial for all of us in our community. I do believe that we should be creative about this and find ways where we could have our community tested, but not just offer these tests, but also make sure that we're educating our community about the CDC guidelines and what, I know that just here in Santa Ana over the last 2 weeks, I've been very open about it. I tested positive for COVID mid-December. So I was out for most of the holidays. And I could hear in my quarantine that there were parties going on all around our neighborhood where I live in. I could hear the live bands every night. There's no parking. So people in our city are still out living their lives, having parties, having huge get-togethers with a lot of people. And, it defeats the purpose of having these tests available for our community. They get tested on a Friday, but on a Saturday, they host a super spreader at their home. And the next day, they receive a negative result on a Sunday, and they just go about their lives. But that's not the point. The point is to test, and you quarantine for 10 to 14 days, the day that you test. And so there's a lot of things that we can do aside from testing, is educating our public, offering that isolation for those residents that need it, and looking into creative ways where we could do third-party billing for those residents that have the means to provide a health insurance policy or a Social Security number. And like I said, I'm very aware that a lot of our residents don't have that, so let's provide it for them, at zero cost. But definitely like everything that's been said, and supportive of having something out there and looking into pivoting towards vaccinating our community and having that accessible to our community as soon as it is accessible. I'm not sure what tier we're in right now, but when that time comes, we're ready to roll something out and get our community vaccinated. With that said, Madam City Manager, with the vaccinations, who would handle that? Would it be the city, us, in charge of making sure that would the city acquire these vaccinations and then vaccinate our community, or would we rely on the county to set up a model within our city to carry out the vaccinations?
So Mayor Pro Tem, that's a awesome question, one that I don't know if I can fully answer, but my understanding is right now, the rollout of the vaccinations are being controlled at the state level, and they are selecting who they are administering them to. They're doing that also based on what phase we're in. And in the state, we're in phase 1A, which is only about 3 million people, healthcare workers, and those living in senior living assisted centers. The federal government has actually contracted with a couple different drugstore companies to handle the vaccination of those in senior living centers. The rest of the money, the vast majority of the vaccinations have been distributed to healthcare agencies. So for our region, that would be the County of Orange, and then also to Pasadena has their own healthcare officer, Long Beach has theirs. So they would have received vaccinations as well. But a lot of those vaccinations with the first couple of distributions went directly to hospitals because of the phase that we're in. Unfortunately, the experience hasn't been going extremely well. There have been anywhere from 20 to 40% of eligible people for vaccination that are refusing to receive it, and as well as just the overwhelming conditions at the hospitals right now. They're having a hard time taking the time to do the vaccination. So if I had a crystal ball, I would tell you our link to getting vaccinations, should we set up a site, it would be via the County of Orange. I know the county's focused on their super sites right now, but they did promise city managers for those cities that have councils that want to set up something in their city that they were going to create a model plan of all the things that we would need. So I hope I answered the question.
Yeah, I mean, I know that we had discussed about it briefly in the past, and it's none of us are 100% sure what the county is doing. I know that if there is a way where we could start looking at not necessarily relying on the county, but maybe looking at private groups for vaccinations. I know that like the flu shot, for example, you walk by any Target pharmacy, CVS, Walgreens, and it's, get your flu shot here. And I'm not sure where we are in having these private companies offer vaccinations, if that is even going to happen. But making sure that we're on top of the day-to-day. I know information is changing by the hour. So just as long as we're keeping an eye out and listening for everything that's happening, and what kind of rollout is happening as we move forward. I know that the incoming administration at the federal level has also talked that that's something where they want to really, push in expediting those vaccination rollouts because from what I've heard, they're behind and whatnot. So as long as we stay on top of it, Madam City Manager, to start looking at ways where we could get our community vaccinated, that'd be I'd be very much supportive of that.
Thank you, Mayor Pro Tem. If we could definitely set up a site and do absolutely everything, the only thing that we would be relying upon is the distribution of the actual vaccine itself. One of the things that, like you mentioned, is changing on the hour is the state is the one that determines who is eligible to actually jab the arm, so to speak, or actually give the vaccination. And it's a pretty limited population. The governor has been easing that a little bit. That's really where I believe that there's a big speed bump on getting the vaccinations out, is having enough individuals that the state considers eligible to do the vaccination. Apart from that element, I think we would be able to successfully overcome the other issues.
Okay, good. That's good to know, Madam City Manager. Thank you for that. And just for transparency, I've thankfully tested negative twice. I know I already mentioned that I did end up testing positive, so I feel great. Thankfully, the symptoms for me were very minor, but it's I've definitely seen it in my own family how it affects people very differently, depending on your age and your past health issues going on with anybody. But thankfully, I'm all good now. So I know it's been hard for our community, but we're doing our best we can, and hopefully we have something soon. And that's it, Mr. Mayor.
Great. Thank you for those comments, and I'm glad you're feeling better, Mayor Pro Tem. I think I saw Councilmember Lopez's virtual hand raised. Was that intended from you, Councilmember?
Yeah, I have a question for our city manager. Christine, can you let us know if the county is still offering their own isolation program?
No, I don't know the answer to that. I can certainly find out and inform all of you of what the answer is. My apologies.
That's okay, thank you.
Great. I see Councilmember Becerra's hand up as well, his virtual hand, but if you don't mind, if I could make a couple of comments in between here, just so we can keep the conversation going. I had a couple of comments and questions as well. So thank you all for, staff and members of the council for participating. And we certainly do have a lot to be proud of for what we did in, the latter part of 2020 in providing testing, but also a lot of the ancillary resources that were so important that were provided by the CARES Act funding. The real unfortunate part about it was that money went away at the worst possible time, right? So we ran out at the end of the year when things were spiking and then when things were getting very bad. And so, right now we're entering a very, very bleak season, probably the worst month of the entire pandemic period, right? January is expected to be the worst month of the time of this entire pandemic. So what's unfortunate is that we expected there to be a federal package that was just going to create a pause for us so we could continue doing what we've been doing. And that didn't happen. And Congress funded a lot of things, but they didn't fund any direct monies for cities and local governments to provide additional testing and vaccines. So that means it's incumbent upon us to make a decision. Do we decide to wait until vaccines arrive and do nothing and allow others in a city that is the most impacted city in the county? So just as an example, or just to kind of make the numbers graphic, we make up 10% of the population in Orange County, but yet we have 20% of the cases and 20% of the deaths. So that is a very, very startling number where some zip codes are testing in the 25 percentile, meaning 1 in 4, 1 in 5 people are infected. And that is very stunning, and that is very unsettling as well. So had we not been in this moment, the worst month of the pandemic, no resources provided from the federal government, the numbers just going through the roof, and it being as difficult as having one of our own colleagues who tested positive as well. And I know many members of my family and friends as well. We don't need to go too far. I think the degrees of separation are no longer 3 and 4 degrees. I think it's immediate. That circle is closing in on us very quickly. So I like what I heard from everybody. I think that if vaccines were here, I'd say, why are we going to test? Let's just start getting people, vaccinated and let's get going. But what my conversations with both the federal folks at the federal level, folks at the local level and state level, and most recently my conversation with the supervisor for District 1, they are not pivoting themselves. They're going to continue testing because the demand is so high for that and because the need is so high. They don't know when they'll be able to start vaccinating on a very broad scope to the general population. They're doing, frontline workers, law enforcement folks like, police officers and fire and healthcare workers. But I think when I went on the website and when I was speaking to Supervisor Doe, they're at least 3 or 4 weeks out from even considering going to the public and non-essential workers. So that means that, we're at least a month away in the worst month of this pandemic. And, I know providers like Latino Health Access, they've done a great job, but I know they've had to make decisions as well. They're testing 3 days in Anaheim and only 2 days in Santa Ana. So I know that I've been bombarded, as probably many of you have been, asking, where do we get tested? Where do we go? Where do I take my family? I'm worried. And the questions about isolation are really valid. I think that, once a person is tested and they test positive, going home and, basically the transmission rate to the rest of their, household is very high. And that's a danger. And that's something that we need to consider as well. But I do think that, we're at a moment where we have to make a decision, because if we wait for federal monies to come in and we, wait for some assistance either from the state or federal government, we're going to be into February, March, and there are going to be a lot of people whose healthcare and whose concerns about testing positive are going to be delayed. And I think on this one, healthcare delayed is healthcare denied right now. So I think that if Santa Ana weren't the epicenter of the county, then I'd say, yeah, there's no urgency, right? We can go ahead and wait this out, but we are the epicenter. And we are, where, unfortunately, where most of the essential workers are in the county. And we just, it just keeps spreading amongst us. And it's a very, very vicious cycle. So my hope is that, on the good news end, we do have a partner in Santa Ana College that would provide logistically a venue for us to do a mini super site, right? We don't have anything as large as the Honda Center or the fairgrounds, but we do have something like the college where they were doing about 1,000 units of testing a day towards the end. I see that the super sites are still very busy. I don't think anybody is shying away from testing and saying, I'd rather not test and let me go to vaccines. I think if anything, what we're hoping to do and what I've heard is let's test our folks. And as vaccines start rolling in to the city, well, actually to the county, because they won't roll into us directly. Unfortunately, they're going to go to the healthcare agency, which is administered by the county. So we won't get ours until they release them to us. I know a lot of people have called and say, why can't you do what Long Beach is doing, or why can't you do what Pasadena is doing? Well, they have their own healthcare directors and departments, and we don't. So we have to rely on the county, which is tough for us, because I think we've had this conversation. I think we do have a city that's uniquely different than the rest of the 33 cities that we may warrant our own public health director or department. That's a discussion for another day, but I think that, that's something for us to consider. I just think we have to do something soon, because if we don't, then we're looking at the end of January and the numbers from Christmas and New Year's haven't even started hitting. And we're already at capacity at our hospitals. So look, I'm just really concerned, because this is what we were vested to do. The feds just didn't come back and help us as we all expected. We thought this was just going to be a temporary pause, and we were going to continue doing the massive scale testing and ancillary services that we were providing, and it just didn't come through. So, but what I did hear from all of you is that we want to do something, and that's really heartening. So let me go back and just take a few last questions and comments from others. I see Councilmember Becerra. I'm not sure if anybody else would like to address this, but go ahead, Councilman.
Thank you, Mr. Mayor, and thank you for your comments. I had a couple of follow-up questions. I think the comments from all my colleagues just sparked some more thoughts that I wanted to further ask staff a couple of things. So staff, how many residents took advantage of the quarantining option when we offered it in 2020?
I will have my assistant city manager answer the question on how many individuals took us up on our isolation assistance. And if you don't know it off the top of your head, I'll try to also pull it up, Stephen.
Yeah, I don't know it off the top of my head. It was a couple of hundred, I know that. But if you remember, isolation assistance was for the healthy folks.
Okay.
So the folks that were ill stayed at home.
So wait, so we were not offering quarantining to anybody that tested positive?
No, we weren't.
We were offering quarantine to their family members to protect them, to ensure it didn't spread within the household.
It was my understanding that if somebody tested positive, we were offering them the ability to isolate from the rest of the family.
Which we achieved by letting them be in the house alone and protecting their family members.
Okay, and so how much of the CARES Act funding did we spend on that effort in 2020?
I can pull that up for you. Stephen, if you have it readily available, if not, I can pull it up.
No, I'll work on it.
If you want to move to a next question, council member, I will get you the answer to that previous question.
This one hopefully might be a little easier. So whatever quarantining efforts that we could possibly pursue in 2021, would those efforts potentially be reimbursable by FEMA?
You know, I don't know if that would be an eligible expenditure to be reimbursed by FEMA, and FEMA does only reimburse at a 75% rate.
Well, 75% is still better than zero, so I like those numbers. And then a couple more questions. So who would the county have operate the vaccination distribution sites in Santa Ana? Would it be the county themselves? In other words, if to use the example of Santa Ana College, would it be county staff and infrastructure operating the site at Santa Ana, or would they insist that the city somehow help with the operation of the site?
So currently the county has deployed what they call Operation Independence, and it's a goal to have everyone that's willing to take the vaccination be vaccinated by July 4th. Their first effort is 5 super sites that they would be taking the lead on. Unfortunately, I'm not aware that there's one of those sites planned in our city. However, they would be taking the lead on those. They have asked for cities to step up and assist with those super sites, but as an alternative, they have discussed that if there are cities out there that want to open up their own, they would give us a model as to everything that you would need to do and provide the vaccinations to the extent they have the vaccinations. And so it could be city run. Obviously, we would have to procure the appropriate staffing levels of those that are authorized by the state to provide the vaccination, but the city certainly is capable of the logistics, such as, traffic control and the site and different supplies that are needed. But right now, as of this morning, the county did indicate they're sticking their efforts into the 5 super sites. But in addition to that, you do have healthcare providers that are receiving their own distribution as well. So I don't know what's on the horizon for potential partnerships or contracts with pharmacies. I know the federal government went that route with senior living centers directly. The county is working on an agreement with Albertsons to possibly use them as a distribution site, which I believe we only have one Albertsons in our city. So that's why I do think if we're able to do it, we should explore trying to get a local vaccination site.
Okay, no, I appreciate that. And, one thing that I've been reading out there is that OCFA would be very instrumental in any county efforts when it comes to distributing the vaccine. And given that we utilize OCFA as our fire services agency, would that put us at an advantage then by virtue of the fact that we are utilizing the entity that would be mostly responsible for helping to coordinate that distribution effort?
OCFA right now is collaborating with the county, and they're the ones that are helping develop the model vaccination site. I do know that with the people that are authorized to do the vaccination, it's doctors, it's nurses, it's pharmacists, and it's paramedics. Unfortunately, as you can imagine, those types of technical people are extremely busy doing other things. So the governor had, I believe he has included EMTs and potentially dentists. So I'm not sure if we pulled resources from our fire stations that are staffed through OCFA to pull EMTs off, it would more than likely have to be on overtime to do that. I'm hopeful that they will loosen the restrictions on who's able to administer it. You know, we do have an excellent college in our city. I believe they have over 200 nursing students that personally, I would take a jab in my arm from a nurse, probably more than a dentist, but my daughter is a nurse, so I might be showing preferential treatment. That's what I know as of today, Councilmember.
Okay. And so did we ever find out how much of the CARES Act funding we spent on quarantining?
No, I'm sorry, I was talking. Give me one more minute. Do you have any other questions?
Steve Mendoza, did you?
Christine, I have the answer on that.
Go ahead.
207 people that were among 81 families and $120,000.
120,000. Okay, thank you. So I think what I would like to see is I really believe that with the testing that, you know, we need to do something more than just testing, because sometimes I think we're confusing testing with actually helping a family or helping a person as far as get through it. And I think if we really want to be pragmatic and proactive, you know, we already have testing options available within our city. So I just, because we have such scarce resources, especially going in because of the pandemic's impact to our local economy, I am being a little more scrutinizing. I mean, not that I wouldn't anyways, but I want to really just bring about the attention that we don't want to duplicate efforts. And if we do have partners at the county and other places that are providing testing, I would ask us that if we're looking to give direction to our city manager and staff to have any allocation towards this effort, I hope that the effort would also include resources for quarantining as well. I think that's something that we need to really look at, because if a person who lives in a place with 5 other people comes home that's tested positive, that doesn't do anything to the situation. I mean, they're still going to spread it, but at least if they get tested in time and they're able to know in time before they spread it to the others, then the quarantining really makes a difference. And I think that's where we're going to actually help people not spread it. Just letting people know that they have COVID doesn't do anything, especially given some of the residential situations that we have in our city. So I just really strongly advocate that we don't duplicate the efforts and that we coordinate. And I would support an allocation that really looked at how we can coordinate with existing providers, such as who's providing it for the county, and coordinating with the 6 existing sites that are in Santa Ana today that are offering testing, and that we have some sort of provision for quarantining, and if city staff would follow up on whether that could qualify as reimbursable under FEMA, even if it's at the 3/4 threshold.
Great. Thanks for that comment. I think I see Councilmember Hernandez's hand raised. Before I give the floor to Councilmember Hernandez, Madam City Manager, do you know on these other sites, these other clinics, I guess, that offer, or these nonprofits that are offering testing, are they considered large super sites to the scale, or not super sites, but to the scale that we were providing testing, you know, when we were up and running?
Mayor, I don't believe so. I think probably the closest one, which was similar to ours, would be Latino Health Access, where they were going to different locations and they had a higher number of processed a day. Those other locations are community clinics.
Okay, Got it. And so, and that's what I recall as well. And I know Latino Health Access, our conversations with them is they've reduced the number of days that they are spending in Santa Ana to 2. So they're only here 2 days out of the week. And that's, from the number of requests that we had towards the end, about 1,000 people testing a day. That's a lot to condense into two days, even with the other small clinics and other small community nonprofits. So let me go ahead and give the floor to Councilmember Hernandez.
Thank you, Mayor Sarmiento. Ms. City Manager, I wanted to ask a question around the bidding process. I know that we would potentially be entering negotiations with different providers. I received an email as we're in this meeting from St. Jude Laboratory, which is a molecular diagnostic laboratory. And I know that this organization had offered to provide some services at no charge. I'm going to go ahead and share this information with you. I think that if we can maximize service providers, I know that there's some very generous laboratories that would be willing to do that. I think that's also something that we should integrate into that plan, is maximizing those relationships and having that community-based support. I think it's certainly something that we should explore. And also, my second question is, what is the process going to look like is there an RFP process that we're going to have? What does the application process consist of?
So I envisioned it, unless you guys direct me otherwise, similar to how we did the CARES money. When we initially received the CARES money, you blessed the different buckets that for the different areas of focus, whether it was assistance programs, rental assistance, personal protective equipment. And then I did have the authority to go and procure what I need to do to satisfy those. This isn't really a formal invitation for bid. It's more of a request for proposal, since it is quality is of importance as well, along with cost. How we've done it in the past is we called around, because quite frankly, there aren't a lot of organizations that can come in and do testing at the volume that we were doing. But to the extent anybody reaches out to you, please, I will definitely research them. It sounds like that they might be offering just laboratory services. I don't know if they actually do the testing component itself, but any information you want to send my way, we definitely will vet it. We did this when we received the CARES dollars through our EOC to try to vet what individuals and entities out there are capable of doing this work. So it's not formal. I'm not advertising in a newspaper or anything like that, unless you do direct me to do that. But it's more been an informal process because it is a pretty small pool.
Thank you, Ms. City Manager.
Great, thank you for that question, council members. So I think I don't see any other virtual hands raised, but I guess what staff recommendation is to go ahead and authorize you, Madam City Manager, to negotiate on our behalf, because this is also an urgency item. There is obviously some time sensitivity to this. If not, we would procure it in a normal way and we'd go out and spend a few months and circulate it and come back. But we realize that there are real lives at risk. So I know that the way you've broken it up for us is that 500,000 of that comes from community development block grant money that we already have. So it's not general fund money. But the 250,000 in addition is reserve policy money. So that is obviously, those reserves were intended. And I remember when we, way back in councils before, when we set those funds aside, were for fiscal emergencies, but really any emergency, right? And that's kind of where we are right now in that moment. So I think that 250,000 of reserve money, and correct me if I'm wrong, but I think we have in our reserve policy somewhere near 40 million. Is that what the amount is, or what's the amount in our reserve fund balance?
So with the closure of fiscal year 1920, we did close the year with more money going into the reserve than we had anticipated. So the 250,000 would be taken from unrestricted reserves. So it would wholly preserve your reserves that you require to have on hand. Just as a reminder, the city requires 16.67% of annual recurring revenue to be untouched, and we do have that fully intact. And then more recently, under the leadership of the council, you established an economic uncertainty reserve at 1%. That would still remain fully intact. So it would be based on our projections, and you'll learn a lot more as we bring forward the mid-year budget update and the results of last year's financial results. We would not be dipping into any of those restricted reserves for the 250.
Great. And what I recall is in the past, I know we spent this much money on vehicles, right? So I certainly think that this is a good allocation of funds because it is so urgent, immediate, and necessary, and it really is taking care of the health, the lives of our residents. And I like the idea of having a blend of different approaches here. If take-home tests are available, maybe at the site. I like the idea of a central site, maybe a mini super site for Santa Ana, because what's been really difficult is when people ask, why does Costa Mesa and Anaheim have large super sites and Santa Ana doesn't, when you guys have the highest rates, when 1 in 4 of your folks are testing positive? And so it's a tough question for us to, I think, answer. And it's a long answer, right? Because you have to say, well, we don't have logistically those large venues. But nonetheless, I think what the question, calls for is that we have to have some response, even if it is a proportionately less response, but something that's going to be responsive to our residents. So I like the idea of maybe this being a not to exceed as well, because if, let's say by some miracle, which I don't think that is going to happen, that we're going to have vaccines drop in our lap, in the next few weeks, I just see this as a bridge out of January, which is going to be a horrendous month. That's all I see this as, is really just something to get us through this really difficult moment. And then I think we transition seriously to vaccines. I know that the vaccines are going to go through the county. That's just the way the state has it structured right now. But I've been in discussions with the other mayors from the 13 large cities. And one of our primary advocacy points is going to be to have direct vaccines coming to the 13 largest cities in the state, so we can administer those directly. That is a big ask. I don't know if it'll be received well, but nonetheless, it's something that I think all of us on that call that I was on last night said that we were going to be pushing for. So I'll go ahead and, I think all the comments that were made were really, really good in that we're blending, a site that we have, at Santa Ana College. I think that, people recognize as a trusted site. We have a partner there that's willing to go ahead and allow us to use that. While at the same time, I think Clinic 360, if I'm not mistaken, Madam City Manager said they could even do mobile sites in addition to that. So maybe go into those zip codes and those neighborhoods that are really, really hard hit and maybe do something on site, but have, take-home tests available. And to the extent that there are, funds available for isolating, that would be great as well. I just know that we're dealing with a limit. I mean, we had $28 million to work with. We're now working with 750,000. So, that is a very, very small amount. But again, the way, we're looking at this, or at least I'm looking at this, and I've heard from others, is just get us through January, because it's just going to be such a horrendous moment for us. And, we just don't want to be, without any large enough proportionate resource for our residents to access, and asking them to go to Anaheim or Costa Mesa for some of them is just very, very difficult and challenging. So in any event, I'll go ahead, and if there's a motion to support the staff recommendation, I'll go ahead and entertain that at this moment.
Mr. Mayor, I would be open to supporting the staff recommendation with one modification, and that would be to allocate a set amount. So since I think what we heard on the call was a little over 100,000 for calendar year 2020 was spent on quarantine efforts, I would like to ask that my colleagues support us allocating 50,000 through, let's call it June, assuming that we will have the, vaccine being distributed by that point, but we can revisit it at that point, but a not to exceed amount of 50,000 through June dedicated to quarantine efforts. And if that was supported, that'd be my motion along with the rest of staff's recommendation.
And just for clarity, I like that motion for clarity for staff. And your question, and I think Mayor Pro Tem's question kind of got me thinking. I always thought that the isolation at the hotel was for those that were tested positive, right? Because it made more sense to me that you sort of segregate the family member that's positive. But maybe that's something you can research for us, Madam City Manager. Maybe that's an easier thing than moving an entire family to a hotel to isolate. Maybe moving the individual that did test positive might be logistically easier.
Yeah, certainly. I know from just a couple of the stories of the individuals we assisted, some of the hotel partners were concerned with having positive individuals in their hotel. And then some of the individuals that were tested positive, they wanted to be in the comfort of their home. So there's ask and wants on both sides, but we can certainly explore that. With the modification, I do want to point out that because we have a blend of CDBG and general fund, to the extent I'll maximize the use of CDBG, but it must meet the criteria for use of the dollars, and then the rest will definitely have to be expended from the general fund portion.
Christine, I would ask that if you could also come back to the council, maybe just an email to us to let us know from your research if the quarantine efforts are FEMA eligible. And if it does, then that makes everybody's lives a lot easier.
Good point. So there's a motion by Councilmember Becerra, and I think, Madam City Attorney, you probably wrote that down, or the clerk. Is there I see a hand raised by Mayor Pro Tem. Mayor Pro Tem.
Thank you, Mr. Mayor. What Councilmember Becerra said got me thinking about the isolation. And even if it's, because I know that CDBG monies that we're using, Madam City Manager, are restricted to income-based residents. I'm assuming that the residents that would seek isolation are those residents that are living, 5, 6 to a 1-bedroom apartment or more, or 2 families to a single family home, which to me, that shows that it's in their low income. I mean, if you're living in cramped conditions with multiple family members, it's because you got to make ends meet and they can't afford something else. So I feel like there could probably be some loophole in that restriction of CDBG where we could say, well, we used it to house low income families that tested positive or whatnot. So I think there's room there where we could work on something like that towards that. Maybe it's something that could come back to us at the 19th City Council meeting. I'm not sure logistically, just see if we could find something else. Just a thought, but I am supportive of something like that.
Okay, I believe I understand the request. I first have to confirm that we have CDBG money that can be used for that nature, since the amount that we are dipping into is earmarked for testing and vaccination. So I will first check that. I will confirm the FEMA eligibility and then certainly report back to you.
Okay, thank you, Madam City Manager. And as you were speaking, I started thinking, would we be able to use any housing dollars that we might have, any in lieu fees that were paid? I mean, I know that's for affordable housing, but any housing monies under, I guess that would be CDA, under Stephen Mendoza's department that we could use towards finding rooms for isolation?
Was certainly, if we find out that the CDBG dollars are not eligible for that activity, we will start to look at those other buckets before we would shift again to the general fund.
Okay, thank you.
Great. So Mayor Pro Tem, was that a second, or was that just adding to the motion?
Oh yeah, I'll second the motion. So it's to go with staff's recommendation, but also try to find $50,000, give or take, from here to June, right, Councilmember Becerra, for additional isolation rooms for families, right?
Correct.
Right, and then the, finding out if FEMA, if it's eligible for the.
Right.
Reimbursement. Yeah.
Great. Okay, great. Thank you for those clarifications. Those were good. I see Councilmember Fan has her real hand up.
Yeah, I actually couldn't find the button. So anyway, so just for clarification for myself, I heard it as Councilmember Becerra asking that of the 750 total, out of the 250, if we cannot get FEMA reimbursement or CDBG cannot be used for quarantining assistance, that 50,000 of the general fund dollars of the $250,000 are earmarked for quarantining services.
Be made available for quarantining because there's a possibility
Okay.
we'll expend it. Yes.
So it's not an additional to $50,000.
No, it's not an additional. This would
Right.
be of what we're allocating per staff's recommendation.
Okay. That was all. Thank you.
Okay, that's I was under the first impression, Councilwoman Pham. So thank you for that.
Yeah, I was
but
like, wait, I think we're talking about different things.
Yeah, my second still stands.
All right, which means that we're going to have to look for a vendor that's very cost effective. So in any event, any other questions or comments from the council? Okay, seeing none, Madam Clerk, if you don't mind calling roll.
Yes, Councilmember Becerra,
Yes.
Councilmember Hernandez,
Yes.
Councilmember Lopez,
Yes.
Councilmember Mendoza,
Yes.
Councilmember Fan,
Yes.
Mayor Pro Tem Peñalosa,
Yes.
and Mayor Sarmiento.
Yes. Thank you for that, everybody. I think, as somebody said, this was important. This is important. And it's also, for me, a real privilege to serve with others who care so deeply about, our residents, because we could have ignored this, as, some have, and we didn't. And we know it's difficult. We know it's not easy. We know that we have to be disciplined with our expenses, but this is one that I think is very important. And again, it's not this, massive amount, but it is something that will give some comfort, hopefully, to many of our residents. And about that, we should all feel good about. So I know it's not on the agenda, on this special meetings agenda, but do we, Madam City Manager, do you have any closing remarks or any?
Just a reminder, sir, we do have a hold on your calendars for a council planning retreat that I'm looking forward to, and more than likely we will have an outside facilitator that will help guide your discussions as we try to coalesce our priorities for the upcoming year.
Great, thank you. And one last thing I remembered, just so as your negotiations with the vendor go, just go ahead and, obviously, advise the council or inform the council once that's done. And hopefully the sooner the better. Obviously, like I think all of us said to a person, the immediacy of this is so important. It's so critical. But the good thing is that I think you have a couple of leads already and a couple of options that you're already pursuing. So I'll go ahead and just, if anybody has any other, closing remarks to make rather than going round robin, just, raise your hand. Mayor Pro Tem. Mayor Pro Tem Peñalosa, is your hand raised? Any other takers? Anybody else want to make a Councilmember Fan?
Yes, for anyone else who's watching out there, I just wanted to share that, and I've asked for permission, but the Mayor of Aliso Viejo, Tiffany Ackley, shared a very personal story about her family being affected by COVID. And I just wanted to share this with the public to remember, so that we all remember to stay safe. Her mother, who's 77, was taken to the hospital via EMT, but they went to 3 different hospitals they had to call 3 different hospitals because there were no hospital beds for her. COVID is so real, it's running rampant in our community, and we need to avoid family gatherings. That means birthdays, lunches, wedding anniversaries, whatever it is, we have to avoid it because that is how COVID is being spread in our communities, and there are not enough resources to go around. We are doing the best that we can, but until Congress does something to give local agencies and individuals more resources, we're doing the best that we can. So we need everyone to help. I don't want any of our residents to be the one on the stretcher, on the sidewalk, waiting for hours to get an ICU bed. But it's already happening. You know, Chalk Fullerton has military style tents out because they don't have enough space. So once again, I just hope that anybody who can, please stay home unless you absolutely have to go anywhere. And please stay safe and take care of yourself and your families. Thanks.
Thank you for those words, Councilmember Fan. I think that all of us are just stunned by some of what we're seeing and some of what we're, hearing from our neighbors and friends in, our city and others. Mayor Pro Tem.
Thank you, Mr. Mayor, and sorry about that. I'm trying to multitask at work, and a phone call came in right as I was trying to speak. But I wanted to take this opportunity to briefly discuss the events that happened yesterday. I'm sure we're all aware, there was a domestic terrorist attack at our United States Capitol, and it was the most heartbreaking and disruptive thing to see that I had ever seen personally in my life. To see our elected officials across the country under attack at our United States Capitol, and it was very frustrating to see and heartbreaking, and shame on the United States President, shame on the United States Capitol Police, shame on the perpetrators that led this, and it was disgusting. And I wanted I know I briefly spoke with a city attorney yesterday and the mayor earlier today about possibly bringing forward a resolution condemning the events that happened yesterday in our capital, and condemning the president, for enabling it and not condoning it, and wanted to see if it was possible and if my colleagues would entertain the idea of having a additional special city council meeting, given that our next city council meeting is until January 19th, which is the day before the inauguration, where I would thought about bringing an 85 item forward, but that would put us out to the first meeting in February. So I figured if my colleagues would entertain the idea of having another special meeting where we could bring forward a resolution condemning the events that happened yesterday, for either tomorrow or possibly Monday. And that's basically it, is having a additional special meeting where we would bring forward a resolution that would show a united effort on behalf of our city that was constantly, cities like ours were constantly under attack by the administration over the last 4 years. And we should, send a strong message that we're against and condemn what happened yesterday. So not sure. How my colleagues feel about that. Yes.
No, I think you glitched there for a little bit, but we caught the majority of it. Yeah.
Okay.
Very good.
So, well, no, I was just basically saying if not sure if my colleagues wanted to chime in, or you, Mr. Mayor, or the city attorney on what we can and cannot do today, or at a special city council meeting, if my colleagues would be interested, for one tomorrow or Monday, where we could address this and vote on a resolution. Mr. Mayor or Madam City Attorney?
May I make
Go ahead, Madam City Manager.
Oh, I was just going to make a suggestion, Mayor Pro Tem. If you'd like, staff can work at preparing a resolution denouncing the activities at the Capitol and have it for you at your meeting on the 19th. I don't know if it's time sensitive, but we could certainly proceed with preparing that and bringing it forward for your consideration on the 19th.
Thank you for that, Madam City Manager. I would think that it is time sensitive. I know that there's conversations about both houses invoking the 25th Amendment, which I feel that should be done. And I'm personally supportive of that. And I feel like that's something that could be included in the, again, I'm still want to hear from my colleagues what they would think. But I think the sooner we could get something out there for the public to see that the city of Santa Ana, is strongly against this, would be better. If my colleagues would like to see it on the 19th, then that's fine. But those are my thoughts.
Great. Thank you, Mayor Pro Tem. And I was very, I still am sort of, I'm not in shock because it didn't surprise me, but it was just really stunning to see and have it play out. So yeah, I think whatever we can do to condemn behavior like that is always important. But I see Madam City Attorney's hand up, and I know she wants to make a couple comments.
Yeah, Mayor, if I may, and it's mostly just because I want to make sure that we stay within the confines of the Brown Act. When our Mayor Pro Tem asked me about this, the 19th was something we had discussed. He had some concerns about it, needing immediate attention. The Brown Act says that you can add emergency items to an agenda, but you cannot do that for a special meeting. So, because this is a special meeting, we couldn't add it today. So, if the 19th is not satisfactory, the only option is to call a special meeting, but we can't take a vote on it today. It would either have to be that he's raised the issue, you all have generally heard of his request, and either you as the mayor under the Brown Act can call another special meeting, or 4 of you would have to notify the city clerk that you would like a special meeting. But I just want to make sure that we're not going to take any vote this afternoon, since it's not an item that's on the agenda.
Understood. Thank you for that. I know that rule with the special meetings where you can't do an emergency item there. We could have done it had it been a regular meeting. Unfortunately, we can't do it at this one. But I know that I am very supportive of us being vocal on issues like this, but let me hear from others. I see Councilmember Mendoza's hand raised.
Mr. Mayor, really quick, I'm sorry, Councilwoman Mendoza, but just before we get more people speaking, Madam City Attorney, I just want to make sure that because I don't want this to turn into a discussion now that you brought up the Brown Act. So please interject if.
Yeah, I would say that rather than get into the issues, maybe if people do want to have a comment, what they can just say to the mayor is, yes, Mayor, we'd be willing to participate in a special meeting or not. But yeah, we need not to have a conversation about the issues themselves because it's not on the agenda.
Very good. Understood. Councilmember Mendoza.
Yes, first, yes, I would support Councilmember Mayor Pro Tem's request for the proclamation. And then secondly, I wanted to ask our city manager, since the stay-at-home order has been extended, is the moratorium for the street sweeping tickets also extended, just so that I have that for my own personal knowledge and for my constituents to know?
Yes, we did do an extension to the street sweeping citations.
Okay, very good. Thank you. Those are my only 2 comments. Thank you.
Thank you, Councilwoman. Councilmember Becerra.
Thank you, Mr. Mayor. I just, again, want to thank all my colleagues for today and our efforts to really help our community. In regards to our colleagues' request for a special meeting, I would be open to it, but I would just offer that I think the best statement that we gave the current president was on election day. And I think that statement was not close. It was very resounding. It actually made the impact that I think we all wanted to see. So with that, I think that's where, when it comes to resolutions like this, I think it's important as the county seat, as the capital of this county, that we should be vocal, especially when it pertains to things that directly impact us. I think that unfortunately the current occupant of the office may be ready to listen to the great city of Santa Ana in making his decisions. But having said that, I would be open if my colleagues insisted. But I do believe that if we don't, I feel very comfortable that we have given the statement as a collective city. With that, again, thank you, everybody, and let's have a good evening.
Thank you, Councilman. Any other comments from members of the council?
I just wanted to say I'm definitely open to having a special meeting on this matter. Thank you.
Great. So I think all of us, or most of us said that, we're willing to do a special meeting, not to get into the substance or merits of the discussion, obviously, because it's not before us, but we're looking at more scheduling and whether, folks would be open. So maybe what we could do at this point is contact the clerk and, let the clerk know your availability. I know City Hall is closed tomorrow, and maybe what can happen is, we just figure out a good time, to do it if when it makes most sense for staff, if that makes sense. So, Mayor Pro Tem, I think your hand is raised again.
Yes, thank you, Mr. Mayor. Before we end the meeting, I just wanted to, since we did discuss it or mention it multiple times about the county's at-home kits, testing kits for our community, I wanted to remind the public, whoever's listening, of the website, and hopefully staff could put something out again. I know we have, but if we could frequently remind our residents of where they could get these county at-home kits, that'd be great. But the website is occovid19.ochealthinfo.com. And that's the site where you could get either the at-home saliva collection kit or the nasal swab kit. So whoever can do that, please do so. Request one, keep it for a rainy day. It's important that we stay on top of this as a community. But thank you.
Great. Thank you, everybody. Thank you for the time this afternoon. I think there was good work done, and we're adjourned till the next special meeting or the next regular meeting. We'll figure that one out. But thank you, everybody. Have a great afternoon. We're adjourned.
All right, thank you.